Hello, everybody. The purpose of my speech today is to inform my audience on the growing numbers on young adolescents between the ages of 15 and 24 contracting an STI have increased dramatically over the years. The STI that I want to specifically focus on today is HPV. There were about 43 million HPV infections in 2018, many among people in their late teens and early 20s. Recurrent or untreated HPV can lead to serious health conditions such as cancer. My name is Ebru, and I have been working as a registered nurse for about 2 years now, and I have seen a rise in STDs among young adolescents. The main points that I want to go over today are the statistics on the increase of HPV among adolescents in the United States, health risks, conditions, and risk factors associated with HPV, and some preventative measures and education on HPV to decrease the prevalence of young adolescents becoming infected with HPV. So HPV is the most common sexually transmitted infection. Adolescents are known to be risk takers, whether it's substance abuse, driving recklessly, or having unprotected sex. They might not think of the consequences that come along with these actions. There are many types of HPV. Some can be mild cases, while others can be more severe, such as HPV type 16 and 18. HPV is spread through contact with an infected person, usually through sexual intercourse. It is most commonly spread during vaginal, oral, and anal sex. A person with HPV can pass the infection to someone even when they have no signs or symptoms. HPV is the most common STI in the US, and about 79 million Americans currently carry this infection. About 30,700 cancers are attributed to HPV in the United States each year. Approximately 64% are caused by types 16 and 18, which is the most severe types. There was about 43 million HPV infections in 2018. HPV can lead to a variety of serious health conditions. Most HPV infections do go away on their own within 2 years, but when an HPV infection does not go away, it can cause health problems such as genital warts and cancer, depending on the type of HPV. A person that's infected with HPV can go years without knowing or showing any signs or symptoms. Persistent infection with high-risk types of HPV can cause cancer of the vulva, vagina, penis, anus, and throat, and almost all cervical cancer is caused by HPV. In 2016, about 12,984 women were diagnosed with cervical cancer, and 4,188 women died of cervical cancer in the US. Cervical cancer is the second most common cancer in women, and it is estimated to cause over 470,000 new cases and 233,000 deaths each year. There are no tests available to routinely check for the infection, and to be diagnosed with HPV, there has to be a visual presence of genital warts. Women may find out if they have HPV when they get an abnormal Pap test results. There is no cure for this infection, but the immune system of an infected person has the ability to eliminate the virus from the body within 2 years, although some may continue being infected for many years without knowing, and this can lead to genital warts or cancer. By using preventative methods and being more informed on the subject, the number of adolescents contracting this infection could be significantly decreased. Several things that can be done to lower the chances of an individual getting HPV is getting the vaccine. Getting the HPV vaccine can reduce the risk of getting this infection. The HPV vaccine is an inactivated vaccine that is recommended for those before even being sexually active, starting from the age 13 to 26 years old. After 26 years of age, the vaccine is not recommended due to the probability that an individual has already been exposed to HPV at some point in their lives. Rhode Island and the District of Columbia had the highest HPV vaccine coverage in the United States in 2016. Those with the lowest HPV vaccine coverage rates in 2016 were Wyoming, Mississippi, South Carolina, Utah, and Texas. Another method in lowering the chances of getting HPV is the use of condoms. Although condoms might not provide the full protection against HPV because HPV can infect the areas the condom does not cover, it does lower your chances of getting HPV. Staying abstinent or being in a mutually monogamous relationship would prevent exposure to the infection. Also, getting routinely screened for cervical cancer can also lower the chances of getting cervical cancer. In conclusion, the increasing rates of HPV among adolescents can be decreased if we take the right steps toward getting the HPV vaccine, increasing knowledge on the infection and how it could affect individuals long-term, being in a monogamous relationship, or by staying abstinent. I have discussed the statistics on individuals getting infected with HPV and the serious health conditions that it can lead to, and ways on how to decrease those numbers for better health outcomes. So I hope this informative speech helped shed some light on the subject, and I would like to thank you for your time.